Our next speaker. His topic for today is stress management and mind-body connection. I welcome you all to Dr. Sanjay Sachdeva. He is the founder and CEO at Metabalance Healthcare, an MBA in marketing from FMS Delhi, and also has a law degree and a PhD in nutritional sciences. Dr. Sanjay comes from a diverse educational background in strategy to international marketing to healthcare education. Currently based in India, Dr. Sanjay runs Metabalance Healthcare Private Limited, which is a comprehensive functional and bioregulatory medicine center facility in Delhi and online as well. He's also doing a wellness consultancy for many resorts, Ayurveda and naturopathy and functional medicine clinics in India and abroad, like Niramaya Retreat in Kerala, Aradhana Ayurvedic Village in Rishikesh, and Namami Wellness in Kerala. Over to you, sir. And his topic for today, I'll just revise it. It's the stress management and mind-body connection. Yeah. Please go ahead, sir.
Thank you very much.
I can see your screen as well. And could you please maximize it?
Yeah. Thank you very much. And thank you, Nehaji, for covering such a beautiful, entire plethora of knowledge on meditation and on stress connection. Many of my thoughts and what I want to say has been covered by you already, but I will still try to justify what I have in the little time. Mind-body connect. We've heard a lot about the gut-brain connection, the gut-brain axis, but recently I was doing a study on how every cell of the body has its own mind, and if the mind is powerful enough, then the mind can command every cell of the body not to react or act in a certain manner. It is actually a form of epigenetic intervention, which I was trying out in a lab setting, and doing some research on this, on how the mind can control every cell of the body and can ask the cell to respond to various stress factors or to various triggers. So if the mind, obviously the mind is very strong to activate that brain in every cell of the body. So stress we've already heard from Neha, so I'm not repeating this. It causes a lot of problems, from insomnia to fatigue to impaired concentration to aggressive behavior, digestive issues, etc. But there is a connection between the mind and gut, we do know that. But whether the connection is between mind and body is something that we are now discussing. So every part of the body has, as you know, we have, some people say there are 70 trillion cells. There are other researchers which say they have about 80 to 90 trillion cells, but it depends on the size of the body. All these cells have a mind of their own, and that's what we're talking about, and how we are able to activate that particular cell structure so that including the mitochondrial function and the ATP release is directed by the mind. And our chemistry and biology obviously affect the mind, and effect comes from our thoughts and beliefs. I've spoken many times, and those of you who heard this, about the belief system and how our thoughts and beliefs are able to literally eliminate every stress in the body, and therefore every physiological response that the body will experience. And we still don't understand everything about the mind-body connection, and there's still a lot of research that is going on. I have done some studies in a lab a few years ago, and I've worked on the mice model. But researchers have identified a lot of neural connections which are from the cerebral cortex to the adrenal medulla, which activates body's response. And these findings have eliminated how mental states of stress and depression can influence organ function. So every organ of the body is actually dictated by the master orchestrator, which is the mind. And many a time when I see a patient, I never look at the blood reports. I don't look at the X-rays or the ultrasound. I start looking at the mind connection. So we are asking almost 100 questions to every patient from a defined questionnaire in terms of evaluation of what your aura reads, what your chakras read, and what your mind is all about, in order to understand the psycho-spiritual nature of the physical ailment. So I'm trying to link every emotional stress or every emotional response to the physical ailment in the body. And there are studies to do that, but stress definitely has diminished white blood cell response. I've done a study on this as well, and it has infected, it has diminished white blood cell count. We've done before and after blood tests to see a person who's been in constant state of stress for about 1 day versus a constant state of stress in about 10 days time, and we measured the white blood cell count and have found a huge drop in the white blood cell response. In addition, of course, there are therapies such as cognitive behavior therapy which have helped some of people. We have experienced with cognitive behavior therapy. I've hired 2 CBT specialists in my clinic, and we worked with them, and we've seen the impact of these. But stress definitely has, like Neha mentioned about telomeres, it has a shortened telomere lengths with the stress constantly being there, and the effect that CBT can have on it. So we don't need to have medication for it, but yes, what is CBT, or we call it talk therapy, has an impact on activating positive thoughts and behaviors, and these responses become more automatic. So there have been studies on this many times in cases of PTSD and other cases where we have seen increased brain activity just by practicing empathy and forgiveness. Sometimes patients who have got breast cancer, we've seen that they're holding on to grief, they're holding on to anger, they're not able to forgive, and that has caused increase in the cancer cells. Cognitive behavior therapy, of course, has, as I said, has had a lot of impact on these things. Yoga, meditation, we've spoken about. Neha has spoken about the impact of meditation, but specific studies on yoga, on increase of GABA, and these are the studies that we did at Dabur Research Foundation, have shown increase of GABA levels of as much as 55% just within a 2-week period. Breath, of course, we've spoken a lot about the breath work. I use breath work in a very specific manner, and I have practiced about 21 different types of breath work. The 4-7-8 therapy, which we heard from Neha and the gentleman who was speaking earlier, is absolutely marvelous way of calming your mind and to bring your breath as a means of managing your emotional stress and emotional state. Guided imagery is another way of managing stress, and positive visualization. So I literally create an image, or I take some of the patients into a journey where they close their eyes and they are immediately taken out of their physical body, and they are able to go into a different state of mind when their body, the soul journeys through journeys through the body into another state where you are visually looking at images which are of positive affirmations and positive visualizations. These again have a beneficial impact on the entire nervous system, and it relaxes the body systems as well. Nutrition, as we heard, has a big role to play. I have been working recently with a doctor in Harvard, and I've done trials on 22 of my patients. Also reconfirmed by the SMILES trial. I've been working on this impact of nutrition on moods, and what is called the mood food therapy. And Dr. Uma Naidu is a nutritional psychologist in Harvard University, and I'm working under her to understand more about this connection between the nutrition and the brain. Of course, we discussed about the stress connection with that. We also heard from Neha about the autonomic nervous system and the nervous system, and it's a constant tug of war. This is a very interesting diagram I found on the right side, an image which shows how the ANS system regulates essential body functions like heart rate and respiratory rate and digestion, and how when we put a sympathetic nervous system into motion, what happens when the rest and response mode is activated versus the fight or flight response. It has a huge impact on our body systems. When you activate it, it triggers a huge cascade of changes in the body, and your heart, liver, lungs, everything works on the basis of that system, of which of your system is actually operating or working at that particular time. I have made a comparative chart which I found in one book. Actually, I just added a few points to this. Stress versus rest. So when the sympathetic nervous system is in active mode, or when your parasympathetic system is active mode, so what happens with them? Of course, it's very hard for us to find balance because there are triggers. I will share this diagram with you because it's very hard to go through this now with so many slides and there's little time. But yes, emotions do affect our mind as well. But the trigger to the emotions is very difficult to control sometimes. So there could be triggers such as a pandemic, being laid off from your job, or a child having to left you, or dealing with the death of a loved one, or getting divorced or married, suffering an illness or an injury. These are all triggers which can trigger immense emotional responses in the body. Sometimes we feel that it's quite out of our control. However, as I said in the beginning, if your mind is able to be under control, so if you remember that famous charioteer in the Mahabharata, where Arjuna has control over all the 7 horses or 6 horses which are in front, and with Krishna being the charioteer, the guide, if you have your mind under your control, then no matter what the trigger is and no matter what the disruptor is, you will be able to calm your mind and come into a state of homeostasis, or what we call in Sanskrit sthit pragya, being in the center, neither too much excitation and not too much depression. So, and of course, your body will respond to what you are feeling. And you might, if you are feeling stressed with any of these triggers, then you will get ulcer, high blood pressure, etc., etc. And we've seen a lot of this happen, and we generally tend to treat those physical ailments with supplements and IVs and medicine. But the root cause is something else. So unless you are able to get to the root cause of the problem, we cannot eliminate the problem forever. We are able to then only calm down the body physically. There are many ways to address this emotional imbalance or emotional upsetting. You express your ways, you find somebody that you can talk to. Many times when I do measurement of the chakras, I find a lot of internalization in my studies. I've done over 5,000 tests through a machine called the BioWell, which is developed by a Russian scientist, and this expresses the position of the chakras in the body. And when I see that people are moving towards stress, sadness, anxiety, I feel a lot of people are the chakras are moving towards or are positioned towards internalization, where you are keeping your stress bottled up inside and you're not able to share with others or people that you trust. Living a balanced life is what I talked about, homeostasis or sthit pragya. You don't obsess with your problem, you live state of balance. And developing resilience. Of course, resilience comes with practice. It is a conditioned mind practice program. And you can, of course, use a counselor or therapist, but essentially you have to develop it through meditation. Calming your mind and body can happen, as Neha explained, with meditation, listening to music, yoga, Tai Chi. I practice Tai Chi regularly, 3 days a week, and I listen to specific tracks of music. Now there's a huge science behind musical vibrations and how they are able to impact the body. If you're able to listen to specific music notes at certain hertz, they can activate certain parts of the body in a particular manner to bring those organs of the body into a state of perfect resonance. Taking good care of yourself is very important. So you pamper yourself. I would say I usually encourage my patients to feel what I call as MIP, most important person. I am the most important person in the world. Nothing else matters. First, it's me. So without being selfish, this is what I call as the art of being creatively selfish. So you are creatively selfish without hurting others, but yet you are the most important person. So you have to learn to manage that part. Of course, poor emotional health can weaken your body system. We've talked about this several times. Things to consider is that when you are emotionally stressed, you will get all these issues. You will get all these symptoms which I have mentioned here. They are all caused with emotional health, and therefore supplements and medical interventions and exercise and other interventions will do help. However, let's learn to also get to the bottom of it and find out what's actually troubling this person. I once visited one of the very famous health resorts in south of India, and I spent 14 days over there with about 300 people staying there in the resort. 90% of them had come there to lose weight. And the only conversation that's happening around, people are walking in the morning, afternoon, evening, when they're taking their post-lunch, pre-lunch walks or morning walks, is how much weight have you lost, how much weight have you lost, how much weight have you lost, and there's a constant comparison between 4 kilos, 5 kilos, 10 kilos, etc., etc. Nobody in the resort, none of the doctors ever asked any of the women or men who are putting on weight, why are you eating so much? Why are you stress eating? Why are you binge eating? What is the real cause? There is not even a single psychiatrist or psychologist on board to even ask those people, why have you come here to detoxify your gut? Why is your gut inflamed? Why is your colon blocked? Why is your diabetes gone out of the roof? Why are you eating so much? Why have you put on 50 kilos of weight or 20 kilos of weight? They are just going on to the weight losing or fat loss program, but without asking what the real cause is. And that I find is a very big thing lacking in us. We must always, as healers, as doctors, as nutritionists, as life counselors, we must try to get to the bottom of what's happening inside. Inner Peace Foundation was one of the people that I came across, which does very interesting form of meditation, which is an old form of meditation, comes from the ancient science. I have always felt that meditation is never done. I practice meditation at 4:30 a.m. every morning myself. I used to use a mantra to listen to, then guided meditation, and now of course I don't need all this. It can be in the middle of Chandni Chowk, it can be in the middle of Connaught Place, it can be in the middle of any market or any noise or any party. You can disconnect, zoom out, and get into silence. You don't have to meditate, you don't try to meditate. Trying to meditate is one of the biggest mistakes we make. Just do nothing. It's important to just absolutely do nothing during meditation. Benefits come from doing it regularly every day. It's not an overnight fix, it's not a steroid or an antibiotic. It is something you do, you develop it as a habit. Once I was playing golf with Sadhguru, and he told me, I said, how much time do you spend doing meditation? And he replied back, I don't do meditation. I am in meditation all the time. Playing golf is a meditation. Listening to your friend, just talking to your family or spouse or your people that you connect with, just paying attention to them is meditation. As long as you are in the moment, slowing down the process of your thoughts, bringing down your thoughts from 25 to 35, which we regularly have, to less than 8 to 10 per minute is itself meditation. Slow down the thoughts, slow down the process of the thoughts. Don't be a monkey brain. Don't jump from branch to branch, and don't make the mistake of trying to do meditation. Of course, it releases stress that we all know. IPF meditation is a non-directive meditation. What is difference between non-directive and directive meditation is that non-directive meditation is easier to learn than directive meditation, and it is because it takes your mind into silence and stillness much more quickly than directive meditation does. And the instructions for non-directive meditation are just doing nothing. Allow your thoughts to wander. Allow your thoughts to come in. You are sitting in PVR cinema watching a movie, and you are not a part of the scene that is in front of you. You're not participating in the movie. Similarly, there are incidents that are happening in your life which you are watching as a spectator. Get out of that scene and watch that scene as an outsider. And that's what is looking at it from an outside perspective. Mantras, guided meditation, music, etc., they are all tools to help you disconnect and zoom out. Non-directive is obviously easier. As I said, the instructions for directive meditation are when thoughts come and you're trying to concentrate on something, such as a flame of a candle or a point of light, or with specific, like in Brahma Kumaris, they teach you to open your eyes and focus your attention from the third eye to a point of light. And you're concentrating on that particular point of light using breath and or no chanting. It's just centering yourself on that point of light. So you're making an effort. You're forcing your thoughts from your mind by concentrating on another object. The non-directive meditation is doing nothing, just experiencing silence and stillness. That's what balances your life. That's what will help your health and your body to get back into shape. So scientific research has been done on both types. And when you're in deep, you can even go to sleep when you're meditating, and there's nothing wrong with that. So there are many meditation techniques that you can read about on that, but I found IPF is one of the most important ones. You check yourself, your thoughts are bubbles, your mind, you breathe, and you have a digital detox. Of course, it's very hard to do that. I found it extremely difficult to convince my patients to stay off the phone. I once did a 7-day retreat in Chiang Mai called the Dark Meditation Retreat. where you are forced to go into a cave, and for 7 days you are without light. So there is no sunlight, there is no candlelight, there's nothing. It's complete darkness. You're in pitch darkness. You're meditating 7 days and 7 nights. Of course, you're sleeping, and you get your food served in your little cave room. And there were about 14 people there. Of course, it resets the entire melatonin cycle. But many people who could not stay the 7 days were because they were not able to stay without their digital devices. They said, I can't live without my phone. So they came out of that cave in 1 day, 2 days, 3 days. Only 7 people remained at the end of the 7 day period. Rest of them had all left in between. So that's what I wanted to say about. Thank you so much. I'm sorry, I tried to contain myself within the time that was allotted to me. So this is what it is. Any questions anybody has? I'm free to
Yeah, we
answer.
do have a lot of time. Not an issue at all. Thank you so much, sir. And just thank you for your taking out the time and speak in the event. Your insights and perspective has been truly valuable in whatever you have said in terms of mind-body connection and taking Neha's also into collaboration. There's one question that people are asking that the mind-body connection, has it to do with the dysbiosis inside the gut as well?
So the dysbiosis happens as a result of imbalance of thoughts and emotions, which we experienced with the trigger that happens in your life. As I said, when the emotions are imbalanced, when there's a trigger, then there's an emotional outburst. That outburst can be reflected in the gut. It can be reflected in pain. It can be reflected at the back of your shoulders, at your head, in migraines. Anyway, it can manifest in any way. Once the tree is sown, the tree can grow with one single trunk, which shows the inflammation, and then the branches can go in any direction. You don't know. Only God knows in which direction the branch will go, and it can be this way. It can be gynecological issues. You can develop a cyst in the uterus. You can develop migraines or gut dysbiosis. It can be expressed in any way.
Yeah.
Yeah.
The second question is, the second question is there any role of infrared therapy on mind-body connection and sauna that can help people?
Yes, infrared therapy does help you to detoxify. It does give you an opportunity to be by yourself without your cell phone, and you can have the opportunity to sit with a specific mudra, which we encourage. So we use infrared therapy along with aromatherapy. So we specifically see the disease condition. According to the disease condition, we are giving the specific essential oils so that they can breathe inside that inside the infrared sauna. And then we have got pictures of mudras around the infrared sauna inside. They're able to sit in meditation in that particular mudra, depending upon what you need. So each mudra has got a very specific significance. So when you sit in a specific mudra, breathe a certain air, then the infrared sauna does help, yes.
Yeah, there's one question in the chat box that my sleep cycle is somewhere about 4 to 6 hours only, and this has been in the family as well. I'm absolutely fine in terms of the health. Is it okay to have a sleep cycle of 4 to 6 hours? Is the question.
There's no defined thing, though, although the sleep specialist of the world and all the 29 books of sleep that I've read so far, they indicate a time between 7 to 9 hours. 7 to 8 hours is what is recommended by most specialists. However, if you feel fine and perfect, and if you've done your sleep study, you can do a sleep study these days with very easy to do devices. You don't have to get admitted in Apollo Hospital and do a sleep study. You can do a proper sleep study where you know how many times you've gone into REM. So if you've done typically 5 sleep cycles of 90 minutes each, and with the REM going up to 20 to 25 minutes 5 times in the night, if you completed that in 5 hours, very good. If you feel fresh, you don't have lack of energy. If you wake up at 5:30 in the morning and you're energetic till 10 o'clock at night, great.
Yeah.
Happy with 5 hours.
Yeah, there's one more question by Miss Rajani. Despite knowing the use of mindfulness and meditating, it is tough to keep mind in check.
Yes.
Will simply keeping up a routine of meditating at the same time daily help with this? Though you have answered it in the presentation, but if you can put some light on it as well.
Yes, I usually practice it at 4:30 in the morning, which is called Amrit Vela, when the other forces of energy are at silent mode. So you are able to connect with the divine energy much faster at that point of time. So I usually do it at the same time. But as I said, you don't do it, you stay in that meditative state all the time. So right now I am focused on you. My phone is switched off. I'm not expecting any call. My mind is not racing towards the next presentation. I am just listening and focusing on what I'm doing right now. That itself is meditation. You don't have to work towards it.
Work towards it. Yes. Please share, Anjana is asking, please share your views, sir, on non-violent communication in terms of mind-body connection. How communication can impact, how speech can impact in mind-body connections.
I don't believe in the speech therapy. I believe in silence. I think it's much better rather than having any violent or non-violent communication. Stay in silence, and that's the best way. Do not ever react in your life with any situation, with any relationship, with anybody saying anything to you. Uh, just stay in silence and respond. Do not react. Yes,
Yeah.
EFT practice and stress management is a very big role. EFT is a very good practice. 22 million people in the world are practicing EFT now.
Yeah. There's one more question. I guess would be the last question. This is by Mudassir. Do you have thermography for diagnosing in your center, and what's your opinion on it?
Thermography, no, I don't have it in my center, but yes, a lot of people use it for cancer detection and for detection of inflammation in the body. Because when you do thermography, you will get the red colored mark.
The red color mark, yeah.
Red colors indicate inflammation, and you're able to then check if there is an inflammation. Then you obviously have to address it by reducing it. So thermography helps in identifying inflammation in various stages.
Yeah. Thank you so much, sir, for your insights, and we'll move to the next speaker. Thank you for joining us, sir, and giving your valuable time. Thank you.